Welcome to the Gastric Health Show. My name is Dawn Boxall, and I am excited to talk about this topic. Is it really just fiber, fluids, and exercise, or are there more options? Lots of times that solves problems for lots of people, but not always. We're going to dig into understanding constipation and the solutions. This first video, we are really just going to talk about kind of the why. So first off is structural. So this is something that is inhibiting your body's ability for the movement to flow naturally. So one could be alignment. So you could think things off, like your pelvic alignment is off. So just having the right posture for having a bowel movement really is important as well. So making sure that you are paying attention to that and not excluding that as a why to your issue. You also can't forget about pelvic floor. That's where you get with like a physical therapist that specializes in pelvic floor, and they can help identify. The next one is a bowel obstruction or a partial obstruction. If you've ever had this, then you would kind of know how that feels. If you haven't, we'll dig into kind of what that would look like. Usually, for most people, surgery is going to be involved or some type of scar tissue from something, but there's all kinds of causes of obstructions. Then we can move into surgical. So vagus nerve damage which can happen with weight loss surgery. There can be damage to the vagus nerve. So if there is some severe damage, then guess what? Your motility is going to be impacted, and you might have to do more aggressive things just to have regular bowel movements. The next is imbalance, and this kind of goes in through all different areas of life. So diet is one. Sometimes you have tried that. You have done the fiber, the fluids, the activity, and you've not seen improvement. So what else could it be if it's a diet related? Food sensitivities can definitely drive that. So if you eat a very mundane, regular diet, same thing every day, same thing every lunch, those types of things, you're just a creature of habit and you rarely get variety, then your body could be having some issues with that. Another one is FODMAPs, which stands for fermentable oligosaccharides, disaccharides, monounsaccharides, and polyols. So those FODMAP foods are super great for our gut bacteria until they're not great, until your body cannot handle them. And for some people, those FODMAP foods, they react to, and they are going to be more constipated when they have those FODMAP foods. So it's something that you do short term. You work with a dietitian and get it all back in, and get those back to high levels, get back to consuming high FODMAPs, because that is what's going to keep your gut healthy. Dehydration, so of course the fluids, drinking half your body weight in fluids is kind of the standard. Diet is another one that you can think of with fat. Sometimes people just need more fat in their diet, so that could be another thing to consider. Maybe you're not getting adequate fat each day. The next one is dysbiosis. You have an imbalance in your gut bacteria in the wrong place. So this would be like a small intestinal bacterial overgrowth. The next one is low commensal gut bacteria, and commensals are good bacteria. Those are the things that help keep us healthy. And if you don't have a lot of those, then that's going to impact your ability to have regular bowel movements. The next one is thyroid, and hypothyroid would be the one, and that would impact your motility. You have to work with a good practitioner that will listen to you. And then, of course, stress. You have an imbalance in your life, and stress is out of balance. And it's kind of that communication along that vagus nerve as well. Stress really impacts our gut bacteria, and that kind of communicates to our brain. Stress is a big one. Stress is a really big one that people really discount. and don't put enough effort towards. Next is medications or supplements. So iron and calcium, both of those can definitely increase constipation. Even kind of at the beginning, right after weight loss surgery, you can have issues. Narcotic pain meds, antacids, antidepressants, those medications are all have a side effect of constipation. The next one is malabsorption, and this is bile acid malabsorption. This could go either way. But we do find that bile acid malabsorption can show up as constipation, but there are options. Some people, the bile acid malabsorption shows up as diarrhea, and some it shows up as constipation. So don't forget to rule that out as a cause. And the last one is deficiencies. So this is deficiencies in like magnesium. So maybe you aren't getting adequate magnesium in your food choices. Also vitamin D, there is a correlation with motility and vitamin D. There's also a correlation with vitamin B1, which is thiamine, and vitamin B12. Both of those also have a correlation with motility. It impacts motility when they are low. And then something to keep in mind, if your vitamin A, your iron, your zinc are all low, even just one of them can impact your thyroid level. So just fixing these deficiencies, any of those deficiencies, could improve your thyroid function, because all of those are required in the whole thyroid process.